Good morning, Mark. Feeling ready for today?
Good morning, doctor. Yes, I am. A bit nervous, but I've reviewed the principles. I want to get the scalp flap just right.
Good. That's the foundation of the whole operation. So tell me, what's the very first thought that should be in your head when you're planning the incision?
The anatomical landmarks. For this approach, I'm thinking about the zygomatic arch and the superior temporal line. I need to position the incision to get us to the frontal lobe.
Exactly. The skull's geography dictates our path. Now, once you make that cut, what becomes your immediate priority? What keeps that flap alive?
The blood supply. I need to protect the superficial temporal artery. It's a bit nerve-wracking, but I know designing a broad base for the flap is key to keeping it perfused.
It is. Think of it as giving the flap a wide, healthy lifeline. Now, as you're dissecting, you'll encounter the 5 layers. Which one is our golden plane of dissection?
The loose areolar tissue. It's that safe avascular plane. It lets me preserve the pericranium below, which I know we might need later for dural repair.
Perfect. You're thinking ahead. But we both know the scalp is incredibly vascular. The bleeding can feel relentless. How do we manage that?
Meticulous hemostasis. Using rainy clips right away and having the bipolar ready. It feels like you have to be one step ahead of the bleeding, not just reacting to it.
That's a surgeon's mindset. Proactive, not reactive. Now, we need good exposure, but we also must be elegant. How do we balance getting the access we need without causing unnecessary trauma?
By sizing the flap to our target. We're heading for the Sylvian fissure, so we need adequate room, but the flap shouldn't be excessively large. It respects the underlying anatomy of the brain.
Well said. Respecting the anatomy is the heart of it. Finally, our job isn't over when the pathology is out. What's our last principle, the one the patient will see in the mirror?
The cosmetic outcome. Hiding the incision within the hairline. It's our responsibility to not only treat them, but to help them heal with confidence.
Excellent. You see, it's all connected. You follow the landmarks, preserve the vessels, respect the layers, control the bleeding, and think about the patient's future. You've got this. Let's go.